Hey guys, welcome back to Sheri Proof. Thank you so much for joining me today. If you're new, welcome. I hope that you will enjoy today's video. And if you are already a part of the Sheri Proof family, I so appreciate you clicking on this video today. Before you leave, remember to like this video, leave a comment down below, and subscribe if you haven't already. Today, we're going to be talking all about skincare in pregnancy and by extension, breastfeeding. This is one of the videos that you guys requested, and I actually did a very small video on this topic several years ago. It would have been like 3 or 4 weeks after I actually gave birth to my daughter, who is now 3. So that's quite a while ago. And I also get this question quite often. So perhaps if you're not pregnant right now or you're not breastfeeding right now, maybe this video might be helpful for you in the future. Or perhaps you know someone who is a member of your family, a sister, an aunt, a cousin, somebody who this could be helpful for. Definitely share it with them, because I think it is a topic that we probably don't necessarily think about until we're actually in the situation. At least that was me, right? So I hope that today's video will be very, very helpful for you. Let me start by making it absolutely clear. What I'm going to be doing is providing you with some information and some guidelines, but 100% feel free, and you should discuss it with your doctor, your OBGYN, if you're pregnant or breastfeeding, because different people may have different situations happening that is very, very specific to you, and your doctor can absolutely guide you with regards to ingredients and skincare products as well, letting you know what should be off the table, what you can probably try. Definitely get the final okay from your medical or healthcare professional. Being pregnant doesn't mean that you have to miss out on your skincare routine or having amazing skin, but it can be a very interesting time for a woman when you're pregnant, because you can actually see that there are changes taking place in your skin. Some people absolutely love it because they get the whole pregnancy glow and they have the best skin of their lives. I was very fortunate to be one of those. I thanked my daughter every single day that she was in my tummy, because I just had the best skin of my life. But then there are other people that their skin completely do the flip and they have issues that they never experienced before, and they just want to get it over and done with, because it can be extremely frustrating. This happens because the hormones in our bodies are changing drastically and dramatically, and it can also change based on the trimester you're in. So our skin can do all kinds of things. So some people may even notice that their skin type changes while they're pregnant. Some people go from being very oily to more dry, and vice versa. Although my skin is oily, me personally, my skin actually produced less oil during my pregnancy. So all my foundations, my makeup and everything was lasting way longer, because I didn't have to worry about the excess sebum, and that probably also contributes to other things that I would have seen in my skin. But for some people, something else happens. Their skin changes. Some people get acne and they never had acne problems before. Then you also have the concern that a lot of people have when it comes to hyperpigmentation, melasma, that develops during pregnancy as well, and sometimes just after pregnancy and during breastfeeding, because of the changes in the hormones. So we're all different, and pregnancy can affect all of us in different ways. So for the most part, you can actually continue your skincare routine with a couple adjustments, and we will talk about that, because there are some things that you want to absolutely avoid. And then you kind of need to look at the priorities that you have for your skincare or maintaining your skin, especially during pregnancy and breastfeeding. I like to tell people this. This too shall pass. It's just for a period of time. I know, especially for the people that may be dealing with specific skin issues during pregnancy, that it can absolutely be frustrating, but you want to hold your baby in your hand. We are all hopeful for a very healthy baby being born, and you really don't want to be doing anything that could possibly harm your baby and your baby's development. There are some things that are within our control, so we want to do the best that we can do. And honestly, if you didn't know all of this before, don't beat up yourself. A lot of this information, while it might be out there, is not necessarily talked about a lot. And a lot of people like me probably may have realized when you're actually pregnant and you started to do research and realize, listen, I want to be able to take care of my skin, and I also want to do that in a way that's also going to be safe for my baby. So let's talk about what should be your number one priority when you're pregnant. And that should be to maintain a healthy skin barrier. For a lot of us, your skin sensitivity may actually increase during pregnancy. So this is the overall priority you should have. For many people, there may be some secondary priorities, such as treating the acne that you're probably getting because of pregnancy, especially in the first and second trimester when the androgens tend to be a bit higher. And then, of course, for those people who may be more prone to developing melasma and hyperpigmentation, that may also be a concern, and we will talk about all that today. First, let me talk about the ingredients that you absolutely want to avoid. And the first and the main one being hydroquinone. You don't have to take my word for this. You can actually go do your research and you will see that there are a lot of medical studies that show that hydroquinone, a high percentage of it when applied topically, is absorbed into the body, and there have been studies that showed the damaging effects this can have on your developing baby. So this is one of those ingredients. Even if you've been using it under dermatologist supervision, definitely talk to your doctor, definitely let them know if you're pregnant. In fact, a lot of them may ask you if you're pregnant or trying to get pregnant when they are prescribing this, because of the possible side effects, and the risks definitely outweigh the benefits. So this is one ingredient you absolutely want to avoid. The next one is retinoids, both oral and topical, things like tretinoin, adapalene, even regular retinol. Now, you will find that there have been in recent years some opinions that differ when it comes to this. In general, you will hear a lot of doctors tell you that you just want to avoid this because the research that they do have shows that there is some absorption, and this has been linked to birth abnormalities. So this is why you would hear people say, veer on the side of caution and avoid it. I have actually seen some estheticians say that they have continued to use their retinol products throughout their pregnancy and breastfeeding with no issues. For me, I tend to veer on the side of caution because you will also see that there are a lot of doctors, a lot of dermatologists will tell you, listen, because we probably don't know as much as we want to about this ingredient, and because we've actually had studies or research that shows there's a possible link, avoid it. And that's what I did. I completely did not use retinoids at all during my pregnancy and during breastfeeding. Now, there are a couple other ingredients that might be a little bit more controversial, and they tend to be the acne treatments such as benzoyl peroxide and BHAs or salicylic acid. Some of these products may be wash-off products, and some schools of thought say this could be okay, and the real issue has to be with the percentage that you use, maybe how much of a surface area on the skin you apply it, and so on. But then you will also have some doctors that say just don't risk it because we don't know, even at small doses, what could probably happen and the impact this could have on your pregnancy or your developing baby. So this is one of the ingredients that is usually recommended to avoid. I also completely did not use salicylic acid, which is my go-to acne treatment. And this is one of the reasons why so many people also struggle with acne during pregnancy, because the regular ingredients that might be your go-to to treat acne, such as the salicylic, the benzoyl peroxide, and even retinoids, you actually have to kind of avoid during pregnancy. So it can get really frustrating because it's like, what can I use? We will talk about that, but right now I just want to go through the things that you want to exercise real caution with and probably avoid during pregnancy and breastfeeding. The next thing is certain chemical sunscreen filters. Now, when I was pregnant, I used 100% mineral sunscreens, and you're going to be like, oh my God, you mean I have to deal with this white cast? For me, and this was my thinking, that white cast is worth having a healthy baby, especially because, again, this is one of those ingredients that they don't have enough information, but there is some information that indicates that there should be some caution exercised when it comes to these. Specifically, the information that I have found and have known about in the last couple of years is with regards to avobenzone and oxybenzone. And in fact, those two filters I'm actually allergic and have sensitivities to, so I actually don't use them. I don't have them in my sunscreens, but they are very popular. These are USDA chemical filters that are found in a lot of sunscreens. So the issue with these particular chemical sunscreen filters is that with the absorption of this into the skin and into the blood, there is a possibility that it could actually cross the placenta barrier, and that's where the concern is. And there have been studies that have actually found these chemicals both in the urine and blood of pregnant women and in the fetal and umbilical cord blood. So you could see that there is some concern, and that's why many dermatologists and doctors will actually tell you, you know what, just completely avoid it and get a mineral sunscreen to be on the safe side. Now, when it comes to these newer chemical filters, like a lot of the ones that I've been talking about, there's also not a lot of research when it comes to pregnancy and how it affects pregnant women. And something you will notice in general is that there is not a lot of information on a lot of ingredients because there is not a lot of testing on pregnant women because we really don't want to risk it, right? And I mean, that's kind of common sense. That's why you just want to veer on the side of caution and stay with what you know is more so safe or the best options for you. And that's the thinking and the mindset that I want you to have as we go through this information and this process. So let's jump into the ingredients that you're probably already using, look at some of the products that you already have, and tell you if you can absolutely continue with these. And the first one is vitamin C. Absolutely continue with your vitamin C products, your vitamin C serum, maybe moisturizer, etc. These are generally safe for you. However, and this goes across the board, make sure you pick up your products and double check that there are not some hidden ingredients from the previous list of things that you probably should be avoiding. Make sure those things are not in there, because there are some products that will contain a cocktail of different ingredients. So for example, if you're using something like the Eva Skin Clearing Vitamin C Serum that I used for many years personally, when I was struggling a lot more with my acne, that is one serum that I actually had to put down during my pregnancy, because that actually contains some salicylic acid. It actually contains a little bit of retinol. So I had to put that down and take up another vitamin C serum. So vitamin C is actually really good, but you just want to make sure and double check your products. BHAs may be controversial, but AHAs or alpha hydroxy acids for your exfoliation is a great choice, and you absolutely can continue with your chemical exfoliation using things like glycolic acid, lactic acid, mandelic acid, even PHAs. Those are fine. You can use them, of course, the way you probably would have been using them. Gentle, consistent exfoliation is always the best way, and this, as well as the vitamin C, will also help in a long way when it comes to things like hyperpigmentation and dealing with melasma during pregnancy as well. Using your AHAs as well will also help you to reduce the possibility of clogged pores, which is one of the things that could aggravate or lead to more acne. So you are actually getting some support with your skincare. The next ingredient to continue using if you were using it, or to look at bringing it into your routine if you did not try it yet, is azelaic acid. Azelaic acid is the one that is absolutely safe to treat your acne during pregnancy, so you may not be able to use the things that you're accustomed using, but azelaic acid, even though it may work a little bit more slowly, is a very effective acne treatment. But not only that, it is one of the ingredients that we use when it comes to treating melasma, treating skin discoloration, skin redness, and all of that, and it does it very gently. So this is that ingredient. If you are having acne, you definitely want to have it in your skincare routine while you're pregnant. Next ingredient, niacinamide. Remember, we were saying that your overall goal is to make sure that you maintain a healthy skin barrier, and niacinamide is excellent at that. It is going to help you maintain and support a good skin barrier, the moisture levels in your skin, but you will also get some additional impact. Why? Because niacinamide actually is very helpful for treating acne and supporting that whole process. It is also brightening. It's also going to help the skin when it comes to dealing with fine lines and so on. So you will be covering a lot of bases by including niacinamide somewhere in your skincare routine. And it doesn't have to be a very huge percentage. It could be a low percentage. The key is going to be consistency. Again, when it comes to your breakouts, something that you could definitely use and keep on hand are pimple patches. And we're talking about the regular hydrocolloid patches, not the new fancier ones that probably have salicylic or BHAs and so on infused into them. No, you just want a plain pimple patch. So if you do get pimples that are coming to a head, you can definitely put that on, and it's going to help the inflammation and reduce the size of the pimple. Now, if you are getting breakouts that are under the skin, cystic bounce, that kind of thing, pimple patches are not going to work for that, but for the others, it might definitely be a saving grace. Now, some of you may be saying, oh my goodness, I really have to give up retinol. And that was actually one of the things that was my biggest concerns when I found out that I was pregnant and I realized that I couldn't use my retinol. So that's actually when I discovered the information about bakuchiol. It was more than 3 years ago when I started to read into this. Bakuchiol was like now coming onto the scene. Not many people were talking about it. In fact, there were not many products that contained this ingredient back then, and I actually found a bakuchiol serum that I used throughout my pregnancy, and that was such a big help. It probably contributed to one of the reasons why my skin also stayed so good during my pregnancy, because I couldn't use retinol. So if you really want to be able to have the impact of retinol without the side effects and the concerns of sensitivity or irritation and so on, you should probably look into this. Bakuchiol now is available in different formats. You can get it in serums and moisturizers to make it one less step for you. So it's one for all my retinol lovers out there who might be freaking out at giving up retinol during this time. Definitely check out this ingredient. And of course, as I mentioned, when it comes to sunscreen, you definitely want to pay attention and start looking and start testing out some mineral sunscreens. Find the one that you could best work with. I have a couple that I actually could very easily work with as well that I use on my skin. So there are options out there. You just need to look and you will find something that you could actually use during your pregnancy and breastfeeding. Now, addressing the issue of fine lines and wrinkles really shouldn't be the priority when it comes to your skincare routine while you're pregnant. But I do understand for some people, you're thinking, I have been working so hard in this area and I really don't want to fall off the bandwagon. So there are certain things that you can continue to use as well. Things like hyaluronic acid, things like peptides, you could keep those definitely in your skincare routine. All the hydrating toners, things like sheet masks and ampules and hydrating masks, those are really good things that you could continue to incorporate in your skincare routine. Again, what you want to do with all of these products is just double check that there are no hidden ingredients in terms of the things that you should avoid. Make sure those things are not in there and you are good to go to pack on that hydration in your skin and help your skin look plump and beautiful and radiant. Skin soothing ingredients like Centella asiatica, which you all know I love, is another good one that you can incorporate. However, there is one ingredient that I also love in this department, mugwort. And I will probably say veer on the side of caution or probably avoid using this one. There are not really studies about mugwort used topically, but there are studies that show that mugwort taken internally, it can definitely cause some things when it comes to pregnancy. And while that is mugwort taken orally, I would say don't risk it. But again, you can ask your doctor, ask your healthcare professional, do some more research. But there are other skin soothers like the Centella asiatica that you can definitely use. So I will say go with that one instead. So what can be a sample morning routine and nighttime routine while you're pregnant, taking into consideration all these ingredients that you should be using or you can use and what you may want to avoid? Keep it simple. So your morning routine, you can do your cleanser, have a nice simple toner with simple ingredients, nothing crazy. Use your vitamin C serum, get a good moisturizer that's going to protect your skin barrier, and of course your sunscreen. At nighttime, especially if you're probably having issues with the acne or probably concerned about melasma, you can definitely incorporate some of the other ingredients that I mentioned. So again, you do your cleansing, you do your toning, you can use your essences once they have none of those ingredients, and here you can actually bring in your niacinamide and your azelaic acid. Now, why the azelaic acid might be attractive to people who probably are having acne and melasma, you don't necessarily have to have those conditions to use azelaic acid. Some people actually use azelaic acid because they know they have the propensity to get the discoloration, to probably get the melasma, and they're doing it to actually prevent and treat as they're going along in their pregnancy. So you absolutely could use it. You can use both together, the niacinamide and the azelaic acid. You could also choose to alternate them, one on one night, one on the other. Either way is fine. Make sure you seal off your treatments with moisturizers as well. Don't forget your exfoliation. Your gentle chemical exfoliation is going to go a long way as well. Whether you're doing it once, twice, or 3 times a week, find a product that is going to work really well with your skin, that's not also going to aggravate any skin sensitivity. So make sure that you include your exfoliation. Whether it is you're using a serum or a toner or probably doing it via a mask, you want to make sure that this is consistent in your routine. Some things that I want us to keep in mind when it comes to this topic of ingredients and what you can use during your pregnancy and breastfeeding is that there's also a fear mongering, and we are just naturally fearful because we want to protect our babies and we want to do what's best for our babies and for our bodies as well. So there is a lot of marketing that can kind of play on that fear and can create more issues. So some people will tell you to go to completely natural products and avoid chemicals, and I am like, you do know that the air that we breathe is a chemical, water that we drink is a chemical. Like, we really need to stop this and stop creating unnecessary fears in people, because we can actually cause them to do more harm than good to their skin. A lot of brands that market this way actually pack a lot of things like essential oils in their products, and for people with skin sensitivities, that could actually aggravate and make your skin worse. So going with this whole natural skincare is better may not necessarily be the best. Once you know the ingredients that you should be using and the ones that you should avoid, after talking with your doctor, your healthcare professional, that's the route that you want to go to choose the products that are best for you. And finally, I know this one doesn't have anything to do with the face, but it is a part of our body skincare, and I do get questions about this. What about stretch marks? I did get stretch marks during my pregnancy, and one of the things that you need to know is that whether you get stretch marks or not is hugely genetic. So it is something that for many of us, we just absolutely cannot avoid. However, we don't like the look of it. We want it to go away faster. We probably want to see how we could delay it or make it not as bad as it might be. There are a couple things that you can do. One of those things is to keep that tummy moisturized. And when I say moisturized, get a nice body oil, a nice body cream. When you come out of the shower and you dry off your skin and your skin is damp, that's the best time to really massage your belly and those areas where you probably see stretch marks coming, and put a good layer of moisturizer. Keep the skin nice and elastic and firm. One of the ingredients that I absolutely really love to use on my belly as well was vitamin E oil. There are so many benefits to vitamin E oil, and it's safe, and it's a really nice moisturizer as well. So I actually had some that I would mix into my body cream and apply, or you could just apply it right over your belly directly or on top of your cream that you're using. Something else that you can use to help the severity of the darkness of the marks as well is lactic acid. You can actually use AHAs, but lactic acid specifically is the more hydrating of the AHAs, and it's one of those ingredients you can actually mix into your moisturizer a couple of times a week when you're applying it to your tummy. There are actually some products that are formulated with lactic acid, such as amlactin. It's a lotion that you can actually buy, use that day as well a couple of times a week. But these are just a couple things that you could look into if the stretch mark issues is one of your concerns. I know this video was quite a mouthful, and I'm sure there are lots of things that I probably left out. I tried to cover the main bases. And again, all of this is really just to give you a guide so that you can go to your doctor or look at the products, because remember, the idea is that we become educated consumers to choose the best products for us. So take some time, sit with the products that you already have. You could go online, put in the names, pull up the ingredients, just double check for some of these things. And if the things that you should avoid is not there, you're free to go ahead and continue with your skincare routine. Literally. It doesn't have to be too complicated, but we definitely want to take precaution. What about you? If you're pregnant right now, probably when you were pregnant, did you change up your skincare routine? Did you learn some of the things while you were pregnant? Did you have this conversation with your doctor or maybe with friends and family? Because I find it something that is not necessarily discussed a lot. I hope that this video was helpful. Please leave a like, a comment. Remember to subscribe if you haven't already, and share this video, and I'll see you guys again soon. Take care. Bye.